Welcome to another episode of Living with FASD, Candid Conversations with Patti Kasper. This podcast is for those who are living with the effects of prenatal exposure to alcohol, their loved ones, and anyone else wanting to learn more about fetal alcohol spectrum disorders. Each week, you'll hear from someone whose expertise is either professional or living experience with FASD. I'm your host, Patti Kasper, bringing you both. Now let's get started with another candid conversation. Welcome back to another episode of Living with FASD, Candid Conversations with Patti Kasper. And although I had been planning on doing the Meliorist Mondays series like once every 4 to 6 weeks, here we are again, the very next week, doing another episode of Meliorist Mondays. Why? Because with life, we have a lot of wiggles in life, and that is going to be the topic of our discussion. For those of you who saw my social posts kind of teasing today's conversation, what we had planned on talking about was the fact that it takes 17 years for society to accept and act upon scientific facts that are discovered. And we needed some wiggle room because one of our 4 meliorists had a family crisis, and so we need to wiggle. And so to honor our sister Deb, we just want to acknowledge that there are other things that we must all attend to in life. And sometimes, life just changes the beat of the music and we've got to adapt. So with that, I welcome back to the mic Antonia, Lindsay, and Jodee. Kulp. Thank you, my friends and sisters, for coming back and joining us today.
Thank you, Patti. Thank you, Jodee.
Thank you.
Yeah. So, 17 years for systems and society to embrace what science comes up with and be able to include it in the way things that we're concerned about affect people. That's huge.
It's huge. It's enormous. It's enormous. I think right now, one example of that is the desire that people have had to have the recent legislation around fetal alcohol spectrum disorders in the United States, the recent
FASD Respect Act.
The Respect Act. People are pinning a lot of hopes on that once that's established, that's going to smooth things out. We're going to have a course that people can follow, and it's going to be regular, and it's going to permeate social work, and it's going to permeate mental health, and it's going to have this wide effect of
and all our needs will be met.
Achieving that penetration into practice.
Yeah.
Because then we imagine that someone wouldn't have to go through what this family did or what this individual did, or we have that uniform wish.
Yeah.
And we have that in other chronic conditions as well, not just fetal alcohol.
Yeah.
You
are so right. I've had type 1 diabetes for 59 years, almost 60 years. Since I can remember, the litany has been, there will be a cure in 5 years.
There we go.
I'm still waiting.
Yeah.
I'm no longer holding my breath.
Right? People are adapting and living while everybody's thinking, if only we have this, then the way will be smooth and manageable. Yeah. If only.
There's a little magical thinking in that, right? The Respect Act passed the House. Praise be to God. Finally, that's been a colossal effort for legislative session after session after session. So, and the next hurdle is the Senate. We can hope and pray, and we can all advocate with our senators and do everything that we need to do to keep moving that needle forward. But that's not going to magically enable diagnosis to happen any faster, because we're dealing with systems.
Well, or acceptance of diagnosis or understanding of diagnosis. Or what do we do about this now that we have diagnosis?
There we go.
Those are all we get to that next step, and now we got to have the wiggle room to get to the next steps. And sometimes we're slithering up them, and sometimes we're going in normal gait, and other times we're skipping steps to get to what we can find available. So yeah, tough. Again, we look at making that first hurdle, and the next hurdle will be there for us.
Yeah, and I think the reality is that life is messy. Systems need just as much wiggle room as people do. You know, this morning we came to the Zoom room anticipating one conversation, and we're going in a completely different direction, which is okay. But systems have the same kinds of things, either, or like with the Respect Act. We were so close in the previous session, we didn't make it by one vote. By one vote. But everyone's hopes were there, and then they were dashed. So we just had to dust ourselves off and go on again. But when things like that happen, maybe it's the funding falls through. Or, like with that whole legislative process with reconciliation, it'll pass the House one way and it passes the Senate a different way. And what's it going to look like at the end? People that have been working for so long have had one framework in mind, which may or may not be the case. So there's wiggle room. I think that's our theme for today.
The thing is, though, that wiggle room isn't something people have in mind when they think of the word science. They think of the word control. Because science is about establishing norms and establishing what's different than the norms and what to do about it. And so in the whole thinking about that, I think part of the thing that happens for people who are living with a condition and the loved ones of people who are living with a condition is we look at science and we think, so science will give us answers. And what science often does is generate more questions. But that's not the way we think about science. We think about it as a way to answer everything. And what it is it's a process for investigating things. Science gives us lots and lots of ways to look at things, to pick up a thing and look at it from all the different angles. And different scientists will use different tools to study that thing and to turn it around and to come up with descriptions of it and ways to understand it. But it isn't a one fact. It's not one snapshot. It's usually a much more complicated. It's like, Patti, when you made that globe instead of the range about what fetal alcohol spectrum disorders are, and you said, no, it's more like the points,
a 3D model,
a globe that are mapped, and that each person has a little different manifestation. They're all centrally stemming from neurological differences. But how they walk, talk, move in someone's life is going to be very individual. We look at your life and we look at Jodee's daughter, Liz. We look at other families, and each of us has a very individual experience, and yet we're talking collectively about a thing that we want others to understand. And so it's complicated for systems when it isn't just a black and white issue, like something that you can take a blood test and you can determine is it positive or negative. Chronic conditions are a lot more complicated than that because they're, as you say, they're wiggly. They're wiggly. They're very individual. And so discovering a way to examine that and to understand it, we've come a lot further now that we're not just looking at autopsy studies, we're looking at fMRI. But still, there are a lot of ways to examine now that we know what it is or what this general flavor is with the condition, what the to-dos are, the now what's. For example, Christy's research, Christy Petrenko,
Yeah.
Her use of applications
Yeah.
and people's ideas of what's going to make a difference in actuality for people living with this and going through life with it, and families raising a child with this.
Yeah, I think of David Gilbert also over in the UK, how he just absolutely treasures everything he can learn from people with lived experience.
There we go.
Yeah. Because I think, if we look at the early research of course, FASD has been around as long as alcohol has, but it's only been a thing for 52 years now? 52 years now. Which is nothing in the scheme of things in terms of science. But if we look at those early studies, where
it's a lifetime. If we look at, for example, Rob Weibrecht, who was one of the first kids diagnosed in the United States, Rob's in his 50s. It's a lifetime.
Yeah. And Rob is running 3D machines and making 3D items that are just absolutely gorgeous and incredible.
Incredible pieces of art. They're 3D printed vases and art objects, just amazing. Flower pots, all kinds of things. Yeah. But art objects.
Yeah.
And they're 3D. He programs them. So yeah.
That's right.
But looking at the research that was done then, they started knowing very little. And so their imagination in what shall we explore was also limited because of their starting place. I think of all the parents who get absolutely freaked out at the hashtag 34 years. My child's going to die at 34. And absolute fear and dread. And that's totally understandable, but that research was limited. It was a small study. It was one study, and the subjects in that study had not been identified earlier, provided supports. So it's a very different picture than what we use now, especially for researchers like Christy Petrenko or David Gilbert. Or all the work being done at UC Irvine, or any number of other wonderful places. And so, it does take time for systems and research systems to kind of catch up.
Well, and to establish foundations.
Years to know something is a fact and have it take 17 years, like a tea bag, to steep until people are acting upon it.
Yeah.
Dr. Ed Riley did incredible research in getting all the MRIs and all the brain scans. All that information is now available, and it's significant. That gave scientists a foundation to look at, to move forward and to compare things with questions that hadn't been asked yet. And as you said, Antonia, a lot of times it gives more questions than answers. But from those questions, if we have the foundational data that's accurate and solid, then they can go in and use that data instead of doing new research on it to move forward.
Well, the thing is that in terms of quantitative research, a lot of people don't know that it takes replication of quantitative studies. You have to hit 2,000 to 3,000 studies and have like results for something to be accepted as a fact.
Yeah.
Then to ask other questions and have the next layer of things accepted as facts from a quantitative perspective. But there are lots of other ways to do research that families are not so familiar with. There's qualitative studies. There are all kinds of other ways of investigation. But unless we live with a statistician, or talk to them, we don't necessarily know the range of all the different ways people can be curious about things and gathering information about it. Yeah. There are key environment surveys. There are all kinds of different tools under the heading of research and studies. There are lots of ways to go about it, but but families don't necessarily know that. And so they go to somebody and they want answers. They say, this is what it looks like. This is what we're living with. And then people look at studies and they're like,
yeah. And there's the mismatch
oh
between, and there's the mismatch between what a clinician or an agency or a doctor's office is, information coming from the person living with it or their family members, with what they see in the textbooks or the journals, right? Like JAMA,
yeah,
or
when they look at a study, they think, my child is kind of like that, but kind of different than that. And does this mean that my child is going to?
Yeah. And there's also the reality that we need to give grace to busy professionals who may not have time, who likely don't have time to keep up with all the research, with all the different subjects with which they have to deal. Because FASD is not the only thing going on in life, let's face it. And I actually kind of feel sorry for physicians with, we think it's ridiculous that, they get through med school and residency and all that, and they've only had like a 30-minute lecture on type 1 or a 30-minute lecture on FASD or a 30-minute lecture on this, that, or the other. But then you have to realize, how many different things do they have to learn about? It's absolutely incredible.
And how much time do they have in a session to do something about it? I mean, the reason that I ended up doing qualitative study at all was because I was being contacted by the local pediatricians and developmental pediatrics at the med school and all of that. They were giving their clients to me to be able to do an hour to an hour and a half assessment where they would have a 15-minute window or a half-hour window. And that was all that their reimbursement would cover.
Yeah.
And at least our team was allowed to have a little bit more time with the families and then to have more time over a period of 6 months initially.
Yeah.
And we could renew those authorizations, but it was complicated, and families don't necessarily know that when they go to an office and they go to talk to somebody, they don't know what the constraints are, and it isn't their job to have to know what the constraints are. Right. They're busy holding the bag with something very, very difficult and very wiggly that they're trying to even out the course of.
And I've experienced this frustration recently firsthand, moving to a new community, having to restaff my medical team with all the different specialists that I need, thanks to FASD and diabetes. Got a lot going on. And I have always had a consumer mindset when it comes to healthcare.
You've had to.
I've had to.
Make that same with Jodee. If Jodee hadn't had Liz right there, be right there with every decision. If you hadn't right there with every decision, how many times were you harmed, and was Liz harmed by people meaning well, but just not knowing
and Patti,
the history?
You research, and so do I. I mean, I worked on Jared Brown's book with Irv Weinstein, and it was the Forensic Mental Health book. That's 500 pages of collaborated research. I mean, with incredible insight. It's, it dealt with collaboration and mental health and FASD and autism, but it dealt with it on a research-based level. So there was a place at that time, and still today, because it gives a good insight into research, what is available in that one category. What can I learn about collaboration, and where can I go? Now, of course, the train moves, right? There's new research since the book happened. There would be new citing that we would have to put in, but a valuable research from Brown to get that book for forensic mental health into the hands of people that don't have time to get it, but yet have to understand it and have to have a solid foundation to be able to do the right thing instead of consistently doing something that's a poor decision for someone's life.
Mhm. Yeah, but I recently, I had hoped that I found the right person for my primary team and ended up saying, "No, I'm not going to work with this team. I'm not going to work with these individuals. Their hearts are in the right place, but they have a different mindset."
And their skill set wasn't up to yours. And that's the thing that's so
Thank
difficult.
you for being blunt in a way I would not.
Well, to be frank, that's what Barb Weibrecht was talking about when she said families are so tired of needing to go to their psychologist, to their mental health person, to their job coach, to their vocational counselor, to the local detective, having to speak to all these different people about something which the families know more about than those persons providing the expertise.
Yeah.
It's a very awkward scenario to be in that role. And Jodee and you, and to some degree, I was in that same role.
You know, it's just like when
it was
when I had my cancer,
very difficult.
Yeah, when I had cancer 9 years ago. You know, and living in Bakersfield, the surgeon there said, "There's no one in our town that has the skill set you need. You're going to end up going to Los Angeles. Choose between these 3 hospitals." Well, I chose one that had an outstanding reputation for type 1 diabetes because I wanted a vacation. I didn't
from having to be the teacher when you're trying to be the patient and just mend and just focus on mending.
Yes, that's where I wanted my focus.
You can't do those 2 jobs at the same time. That's really tough.
Well, but I ended up doing just that because evidently everyone who knows about the current approaches to type 1 work on the medical floors, and I was on the surgical floor.
And you were on the surgical floor.
And
this reminds me of what was,
I had to teach all the nursing staff the difference between type 1 and type 2.
Which is, people would never expect that at a hospital of the caliber that the hospital you were in was known for.
Exactly.
It's a very famous hospital. It's known for a standard of care that is superb. And Jodee was in the same position, having to advocate around the difference between a psychological diagnosis and a neurological experience in the middle of the dialysis with Liz.
Right. And T1.
Just,
you know, and the difference was once there was a psychological attachment to her.
Once they had put that in the paperwork,
then what happened is
everybody's mindset went to this set of train tracks instead of down the other.
And so behaviors that any of us would have, for example, knowing you're allergic to a type of insulin, knowing that type of insulin gives you anaphylaxis, knowing what happens if you get anaphylaxis, and having a nurse sit on you to give you the insulin, you are going to panic. You are going to panic. And then to have
because it's not the right medication and you're trying to advocate at the same time as someone's treating you.
And at that point, you look behaviorally out of control and melting down, and you are worried about dying because you've been there before and you know what it is. That was the last time we let Liz be in the hospital by herself. And originally it was like, she's an adult, she's an advocate, she's good, she can manage it. And then it was like 24-hour a day, 365.
She had skills to manage self-advocacy. They didn't have skills to match her level of acuity.
Right.
And that issue is a major factor for families and for individuals. Because when people are saying, this is how it works for me, if the providers don't accept that information as valid, because their image in their head is, it looks like this. No.
You know, and who are we? We're the 1% of the 1%. So it's not like this is the normal thing. So to keep yourself protected, you, as Patti says, you have to know it. You know, as you know, how many medical certifications did I go get just to make sure Liz was safe?
No kidding.
You know,
how many?
About 7.
Seriously, how many?
7. Yeah.
Mhm.
But to the point where the medical person at the end was saying, what do you practice? What's your specialty?
What's your job?
And I have to say animal behavior. You
7
want to know my
different credentialing
certifications?
programs.
But you do what you have to do as a parent, right?
Yeah.
If you love your person, or if you love yourself as Patti loves herself, and she's responsible for her and her mama, who has Lewy body,
Right?
she has to know what she has to know in order to advocate her. And you with Ellers and dealing with all the things you've had to deal with that, we're all zebras. We all we're all a bunch of, and our kids.
At the agency where I worked, I was a disability specialist, and then I became disabled.
Yeah.
Yeah. Let me paint some context around your one comment for those in the audience who have never heard me say it, because I usually say it in trainings, not on the podcast. The reference to zebras. There's a well-known phrase that if you hear hoofbeats, look for the horses.
In the medical profession, they teach young doctors that.
Yeah.
When you hear hoofbeats, look for horses, not zebras, because you probably won't meet that many people with rare syndromes or rare diseases, or mostly you'll be treating colds and flus and infections and run-of-the-mill kind of stuff,
Yeah. FASD is that zebra, isn't it?
And it gets to be more zebras.
There are many different kinds of zebras, and some of us don't. If we have a symmetrical body, if we have 2 eyes and a mouth and we can talk and whatever, most people think, okay, horse. Until the family or the individual says, no, not exactly horse, kind of striped.
Yeah. Maybe a unicorn.
Based on time spent living with it. Stripes. Pink ones.
Yes. And sometimes the porcupine is riding on top of the zebra.
No kidding.
There we
with
go.
a little bristle attack. So it may be
with the bristle attack like crazy, because the panic is up, the alarm is up, the stress reflex is up, and then they're going to look as if they're acting out. No, they're overwhelmed. There's a sense of, oh no, big time. Big time.
Well,
but you can't just talk it down. You can't force it down. You can't just necessarily medicate it down either. That's the other thing people learned from Liz's case. You can't necessarily medicate it down.
That's when you get a passive parent. When you medicate it down with paradoxical medicine that's supposed to calm them, and it fires them up.
Accelerates them.
Yeah, that's when the mother kind of just chills down as much as she can to try to.
The mother is watching, and people are saying, oh, she's passive. No, she's observing. An animal behaviorist, she's doing her science. She's saying, what am I seeing? What are we seeing? She's gathering data.
Yeah. Am I safe? Is everyone else safe?
Everyone's expecting her to force solutions, take control, do something.
Yeah. You're the mother. Do something.
Because they don't have time. Right. And that seems to be one of the key factors when we're dealing with systems, whether it's an inpatient unit at the hospital, whether it's a system in the community like family services or a counseling center, whatever that system is, time is so highly valued and limited, especially by third-party payers, that they really need, that's why there's an emphasis on trying to find that cookie cutter. This is what FASD looks like.
And this is what you do, as if there's a one size fits all. What do you do? Yeah. But the other thing about time is that because we're dealing with neurological conditions, when we're sitting there in a session, for example, I'm thinking mental health people, they're going to use words and expect a certain time frame in terms of reciprocity when people answer. Mm-hmm. They're not necessarily going to expect someone to reflect and take 3 minutes, 4 minutes to formulate a response. And so they'll interrupt instead of letting the person think. In the book, Embracing Zach, he says a beautiful phrase. He says, "You're stepping on my words." And who he began to talk to was someone who wouldn't step on his words.
Yeah. Yeah. Well,
But
and
most people who are speaking and talking to a speaking child, to a child who can hear and speak, they never expect the latency, the time delay, which is a speech and language issue.
Yeah. So we had an interesting thing. Our daughter, I learned to double speak. So I learned to say the same thing twice, right? And I
Say it
sometimes
one way, say it a different way.
Yep. And I would do that for her so she could process and put in words that she missed the first time. Her partner, who was delightful, he had a delay in timing. And so he hated if I said it twice. He wanted to say it once, shut up, and give me 10 minutes. And so if I said something like, "Would you take out the trash?" And parents expect the kid to jump up, right? Now for Liz, I would have said, "Would you take out the trash? I really need you to take out the trash." That would have been the way I put the two sentences together, right? And she would go do it. I would be doing dishes, and 10 minutes later he said, "Oh, I'm going to take out the trash." But it took him that long which is way longer than a therapist would ever let him take to answer a question. So they learn to mask. They learn to camouflage. They learn to answer your question the way you think, or even with words that don't matter, right? Blah, 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 words.
Yeah, sure.
Well, where I was wanting to hone in on with the whole thing of time, Antonia, your concept of time span data. Parents have the luxury, and teachers do too, at least in the primary grades where a child is with one teacher for the bulk of the day, of time span data.
They can watch what it looks like over a few hours at a time. They can see what that flow looks like week in and week out. They get a sense of the rhythm of it, and it works a little better here. And then by this day of the week, there's kind of exhaustion or whatever. They see that over a month, and then over a few months. Yeah. That's the notion of time span.
Counselors have more time with their charge than physicians.
Than a pediatrician does.
Yeah, like the one practice that I just walked away from, I have such a complicated history. I saw him twice, and I still was not able to introduce all the things that I needed him to attend to.
Holy
and
moly.
He was literally on the way out the door, and I'm still trying to talk to him.
Oh, and there we go. There's a perfect example of what individuals and families face when it's like.
So here's an example. We finally got to neurology, and I searched the gentleman's vitae, and I looked at how he researched and what his data was, and I thought, I think I'm dealing with these personality pieces, and I think I'm dealing with a very high functional, thoughtful person, right? How do I present? I'm not going to go in and tell the blah, blah, blah story because he's not going to listen. He's going to lose it in 10 seconds. He's going to say, "Oh, it's just a mother, blah, blah, blah." So I went in and said, on June 1st, we saw this doctor. At this date, this was the findings. On this date, we saw this doctor. And he's busy writing notes, right? Because I'm giving him the facts. The whole thing that started in 2019 finished with that doctor when he said, "This is a brain issue. It's neurology." And it would not have occurred if I would have done the blah, blah, blah mom piece instead of the scientific, "These are the facts. Please look them up for me."
That is such an important thing that viewers and listeners can take with them in their journey.
Say that again.
What I said?
Say that again.
Okay.
Say that to us again. So
I will start the second time we saw him, and then I'm going to go back. I let another person talk, and it was her partner, and he started telling the story, right? And I immediately saw this doctor who we had eye contact with me, shut down, glaze over, and get us out of there. And when I read the report, instead of seeing the fact that she was being guided on an A-linker, meaning able to walk with a gait, even and not in a wheelchair, that was huge as an asset to neurology, right? An asset. He saw it as she was being pushed in a mechanical device. You know, the day that before that, same months before that, same doctor, same specialist, incredible neurologist. I had researched his personality, seen he was a researcher, looked at some of his papers and how they were written, and decided I was going to take a different approach. So instead of coming in and telling Liz's story, which is really takes some coffee and sitting on the patio together, right? If you really want to hear it. I said, on June 1st, this happened. On December 28th, this happened with this doctor at this clinic, and this is the findings at this. And I gave him a list of 12.
You gave him metrics. What you gave him were measurables.
Yes, and he wrote them down, right? He wrote them. He got busy writing them all down, and he got up. He shook my hand. He looked me in the eye, and we went out. I felt a little bad because I didn't let my team participate because I pretty much took over at that point, but felt it was a very important conversation. And it was pivotal. It changed it from 2019 psychiatric issue to 2025
neurologic
major headaches that were not in her head.
Yeah. They were not in her mind. They were in her brain.
That's right. Yeah. That took that long.
Yeah.
In 24, 5 years to get the right answer and to get the right help, because now we had a neurological approach back from where we had neurological before 2019. But today I wonder.
It was viewed as psychological artifacts, neurological hard signs, and she was having hard signs.
Yeah. And we, and so we have to be really careful for our kids because the behavior is loud. The language is not the language. I mean, Antonia, you and I'm the parent. I'm an animal person. I talk about animals in a different way than you talk about people. You're a scientist. You're a person that works with things like that. We have different language. And often even in our candid conversations, you have to say, let's clarify that. Or I'll have to say, Antonio, I don't know what you mean. Tell me what you mean. And then we work through it until we have a bridge. And that's what we need. We need to know that the language about our children, about ourselves, is something that's valuable to our future. And not just to our programming. So 2 checks on her box in 2022, and when she was 22 in 2005, they checked off anxiety and depression. I had
to qualify her for certain services.
Yes.
They said, we'll code it this way.
Right.
So she can have access to this service. Then later, what happened because they coded it that way?
It haunted her for the rest of her life.
What does that mean? That she was denied services in another way?
And she was
of the way they coded it?
She was pushed. Here's an example that I think I want to share for families, because we had not seen anxiety in her. We had seen situational anxiety, not generalized anxiety. And we knew the difference. I work with animals. I know the difference, right?
Big difference.
And so we had seen situational. We knew what they were as a family. We knew how to prevent it. You go on vacation, you find a place to live that has a kitchen and a bed for her separate, and you buy the groceries that are favored. You bring her.
You knew all the accommodations.
All the generalization stuff we had to do
handling
to make the bridge. Yep. So we made the bridge.
Her vulnerability.
So we could have stabilization areas for her when we did something extreme. And we're extreme family. We did adventures. When we got to medicine and they said she had to control her anxiety in order to get the transplant, Carl and I looked at each other and said, okay, what do we control? Because we don't have that. Okay. And so as a couple of weeks went by, we were looking at this, trying to figure out where's this generalized anxiety that other people see. Can she get anxious? Yeah, in a situation. What happens in a doctor's office? You have 10 minutes or 15 minutes. You may or may not have your clothes on. You're going to be seeing a stranger who's going to be touching you. They're going to be using language you don't know. They don't have a relationship with you, and you are not supposed to get anxious. Well, I'm sorry. I don't know about you, but my blood pressure goes up when I see a new doctor. It just does. And I don't have a reason not to trust, right? And so what they saw then in that 15-minute window was a person that I didn't see, right? The person I saw there wasn't the person that I lived with. It was that situational anxiety. And
did they accept the
we
difference
went,
between that
I
and
didn't
what you
understand.
lived with?
I didn't understand it. I didn't see it myself in the beginning. And we went to a top psychiatrist and she said she doesn't have depression, she doesn't have anxiety. So it was written in the records that she didn't have it. But I still didn't understand what they meant because transplant didn't believe it, right? They wanted medication or something for it. And
So it was still in the written record,
still in the written
in a
records.
way that you didn't know was in there.
Right. And that we didn't know what to do about because it was still in the correspondence of the talk, right? And
In
even
the patient history.
even in the patient history and dialysis was there. But dialysis, now knowing that she had disequilibrium syndrome, which is the cells didn't the water didn't go through the cells, right? So, and that she needed special things and that she was getting migraines at 2 hours, that the kid had migraines for her whole life. So when she was saying she was having a migraine, it wasn't just a headache anymore. If she complained, she was already used to pain. So it wasn't, and when they put the Band-Aid of Botox on her, they didn't know what they did, but it was all because of, they thought, anxiety and being revved up and tense in the neck and the whole thing. What we learned later was not what that was, but
She was having brain hemorrhage.
she
was not migraine.
She was having 40, 40 brain pressure on her brain.
She was building pressure to the point of a bleed.
Yeah. And she did that for 4 years and nobody knew it until we finally got the neurology piece, which was like, wow. But here's where I found out. I was at G7, and that is an incredible FASD conference. This is probably the best one I've ever been to, and I've been there a number of times. But the Anishinaabe people put this on, and it is fantastic. And and they always include people with living experience. And people with living experience are with everybody else, like a neighborhood, right? It's like we're all together in this. This is not me, you, doctors sit next to living experience people. And it's not because they're researching it, but it's because they're chatting it up and they're having lunch with them. It's not like I'm me and
it's
you're
not
you.
subject object.
Yes, it's not I'm me, you're you. It's we are a community.
Neighbors.
Yes, we are a community. We are together. So the first day I'm there, I'm watching a group of people, all different places in this room of 200 or 300 people, bouncing up, saying the same thing. Where's the coffee? Have you seen the bathroom? I need to know where this is. And they're all looking like they are like these anxious little robot, little boop, 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 boop.
Bouncy, very bouncy.
Yeah. And the next day I came in, they were all gone. Now, they weren't gone because they were gone from sitting next to a doctor or a therapist or a researcher or a friend. They were gone because they didn't have to have situational anxiety anymore. They had found the bathroom. They had found the coffee. They knew where their room was. They knew where they were getting fed. All their survival stuff was taken care of.
Restlessness factor reduced with a sense of knowing their surroundings and having accommodations, able to manage much better.
Yeah. And if one of them at that point would have had that a person bumping into them or treating them poorly, we could have had a bristle attack. Any one of those people could have had a porcupine bristle. What would it look like? Out of control, violent, and yet,
or just overwhelmed.
Yeah.
For an hour or so.
That community,
come back after the hour, reoriented.
That community would have done that. They would have said, you know what, take a break, go to the bathroom. That was always my go-to for Liz, go to the bathroom. And so, always finding a safe spot, walking into a new environment and saying, okay, there's the bathroom. This is where we meet. If anything goes wrong, I will be here. If I don't see you within a certain amount of time, I'm going to come back to this point. So, we always set those standards. Yeah, it was an interesting journey. It was eye-opening, the whole thing.
So one of the things that I keep coming back to in my mind as I listen is, again, going back to time span data. If living with it or parenting or living with someone, like a spouse, being able to document what, the context around data points, and couple that with knowing your audience, knowing who you are going to be interacting with. Jodee, that was key for you, was appreciating the doctor's mindset and how best to reach his insatiable curiosity. Because that's what we need with FASD, no matter what our role is insatiable curiosity. That's what will unlock, answers and show us accommodations or show us answers, show us underlying factors.
Missing pieces that look a certain way, but you look at them in a different way and they look kind of different. Yeah. What Deb talked about in PYP was how to talk so teachers can hear. And that's that same principle.
Yeah. And it's important to have the data points, but also to have the context around that. I think of what Key Warner wrote for the beginning of my book, Sip by Sip, was how at a conference, years and years ago, a researcher came up to her and said, "We've known facts about FASD for decades. It is the stories that change hearts and minds and lead to actionable change within society." But knowing, and that's where it's so important to know who our audience is. Are they going to appreciate the data points, the facts, or do they need the stories? Or what balance between the two? But if we don't have the data, we're not going to be able to remember all that we need to share with whom we are sharing.
I'd say a couple things else that can help parents. Something is, for the medical, you've got my chart. And so often I would outline what I hope to achieve in an appointment and not write the story there, but just outline it so that I had, these are the points I hope to discuss. Now, I did learn early on that some of the doctors don't want that. They want you to ask one question and then you're out of there. Yeah, and mine were pages. Well, only once was it pages, and then the doctor said, "I can answer 2 of these." I'm like, "Oh, okay." I wanted all the
Thank goodness the doctor was able to be honest enough to say, "I can answer 2," as opposed to keeping their mask. Oh, I know everything.
Yeah, that's true. That's true. And this was one of our favorite doctors, and she was one of his eventually favorite patients. We found on the last day of her life. He said, "Oh, this is one of Dr. Dean's favorite patients." It's like, wow, you never know, do you? You just never know. Yeah. So yeah, we've all gone a long way. I mean, Antonio, I watch you in your journey of writing PYP and how hard you worked to rally. I mean, there were days that we knew we had to go forward, and it was like, no, Antonio's got to rest, just like Deb today. Deb has to rest today. We have to honor rest. We have to honor the wiggle room.
Well, the wiggle room changes depending on what's going on in the body. And as you say, there were things going on. I live with others, but the reason I felt the press to get the book written was I was battling leukemia.
Yeah, I know.
And the team knew this. The world didn't know that necessarily. but yeah, it helped me focus. It helped me focus. And sometimes a condition does. It provides the motivation, the impetus to say, if I boil it all down, what is it I want people to understand? Yeah. And so there's always a silver lining in any condition. And I wrote that in PYP, and there's a reason I wrote that. Yeah. I'm not saying it's easy, and I don't think it's easy for families. I don't think it's easy for individuals. But we all adapt to what it is that we're living with in our physical body and in the lives of our loved ones. We learn to adapt.
Yeah, and one of my key adaptations is distraction. I need distraction. You know,
It's useful.
even today, I woke up feeling like total crap. Crap on a plate. That was me.
Type 1 is a lot of fun, huh? FASD and type 1 is so much fun. Some days it just feels
yesterday for me.
I had a headache that you would not believe. My right eye was not working. It wasn't turned on yet.
Mm-hmm.
Everything was blurry. My finger is killing me.
Yeah.
You know, and all I can do is one day at a time. And what can I find to involve my mind to get through the day?
Yeah.
Yep.
That's what Embracing Zach did for me. I mean,
Yeah.
I did some of my very best writing after some of my most difficult and heart-wrenching statements from medical people, or waiting during the recovery from a procedure, or
you were doing Liz cares. You would take time. You'd say, I have to do this. I have to do Liz cares for 3 days and I'll be back. And then there were times when you were writing, even in the middle, the caregiving, because maybe she would be asleep for 20 minutes.
Yeah, that's exactly. It was snippets. It was lots of wiggle room in that one. I wiggled right through Zach.
Yeah. But that's we just, that's part of knowing, what our struggles are, and being able to figure those pieces out, what works best for us. Having pain conditions since 1983, it is really extremely rare that I will take a pain medication. I just don't go there.
Mm-hmm.
I would rather use distraction or sleep.
Me too.
I'm with you. I do the same.
If I take anything for pain, even a Tylenol, Carl will know that it's beyond what I would make a statement on, right? Yeah. He'll just look and say, "Are you feeling okay?" It's like, you don't even have to ask.
Bad hour?
Yeah.
Yeah. How about a bad day?
So I'm hoping that our candid conversation today inspires people to think about their own experiences and what are their challenges, and how effective are their go-to strategies around those, and maybe think about how do we assess what are our data points, and how do each of those things that happen to us affect us, not only in our mood and our way of seeing things and coping with things, but also in our bodies, because this is a whole body condition. And life is messy, and we just have to truck on. Like, all four of us, we've done some amazing things in the past year together, as well as independently of one another, and yet we don't have it all together.
Not without stress, not without wiggly days where things feel like they're coming apart. Yeah. I think families have a tendency to take it personally when something doesn't feel even and it's not going evenly. They have a tendency to think, "Oh, I'm failing here."
Yeah.
Personalizing it instead of saying, "Wait a minute, the context is I'm bearing up with this, and yet I'm still doing these other things and getting through it." And families don't give themselves, parents especially, don't give themselves very much credit in having held on where other people would have let go.
Yeah, and self-care is a part of that. Jodee, I'd love for you to tease the audience for the project you're working on now in terms of self-care. It's not just going to get a manicure, although those are nice, or having a Calgon moment and soaking in a bubble bath. It's going to the heart. It's getting out of our head, because everything in life has our head spinning, especially those of us for whom FASD also means ADHD. It's so easy to be stuck up here. In fact, in my using distraction, I stay up here in order to not feel what's going on in my body.
To not get too carried away with all the pain and the discomfort and the effort of living in a body that has challenges.
yet attention does need to be spent on the heart.
Yeah.
What's going on with us here?
So
And the
I
most
will
important
give
connections in our lives.
I will give an inkle, just a little inkle, because then you can probably call this person onto the podcast and talk, and you can talk deeply to her over and over again, because she is a deep person. But I'm doing a project called Yago, and Yago is Yah is the name of the creator. It's the name he uses for Yeshua, Yahweh. And so you ask Yah before you go, but it's way deeper than that. It's basically it's an upside down stop sign. The first thing you do is stop, and then you yield, and then you go. So we teach people how to stop in their lives, how to stop the the treadmill that they're on, or how to stop, and then how to yield and rest, and how and then to go. I mean, not go in the same way as we've been going, but in taking care of ourselves. And it's all simple little things, but it's the best. It's the best simple little things you can do to care for yourself. And I'm grateful for Liz, because she made me always find the best. I didn't have time to pick a counterfeit. I didn't have time to pick not good food. If I was going to get through the next day, I had to buy the best food. If I was going to, and it didn't mean maybe fancy food, but it definitely meant the most qualified food I could have to nurture my body. I had to learn to breathe the right way. I had to learn to stretch my body in a way that would keep it, the synovial fluid flowing, to keep me subtle, to let my body move. And that's what it's all about. It's all about going to that beginning and taking care of us, so that we can go on and take care of someone else. And I'm pretty excited about it. We just handed her off the first proof of the first level 1, and it'll be a 3-part program. Level 1 is kind of an appetizer taste, which is just like good for everybody. Level 2 is we're going to dig deeper and get into the more of the why and the science of what we're doing. And then level 3 is getting master certified and being able to train other people to do it in
Wait a
group.
minute, this is certification number 8?
No. Oh, for me?
I'm teasing you.
I don't know, but I can tell you that all the certifications I have really played an impactful part of being editing of this project, because I had the scientific information to put in and say, no, this isn't the best. This is the best, and this is why. And so, yeah, she and I've been working really closely together on the project.
I think you're competing with our good friend Jared Brown with levels of certifications.
Yeah, but
Are you certification collectors?
yeah, I think so. Well, he's got a PhD though, so I don't. I'm just happy being, I'm happy just doing my life.
Yeah. I had an image when you were first talking about Yago, the upside down stop sign, when I stop yourself from that hamster wheel in the head, just going through life, and yield to what is the most important thing, spiritually and physically, and then walking with purpose.
Yeah, that's exactly what it's about.
Yeah.
Yeah, I think, and she uses massage. So because the 3 massage points we use is lymphatic system drainage, and then vagal tone, and then we use prayer for spiritual. So those are the 3 pretty much hidden systems that need work in order to function well. So yeah.
All right. Well, thank you for teasing that. Now you have to give me her contact information so we can get her on air. And with that, I just want to thank you guys for joining me for another candid conversation. I am so excited about the potential that we have for the viewing and listening audience with these Meliorist Mondays. Really enjoying our conversations, but thank you for the time that you have shared for this. Ladies,
thanks for having us.
Thank you, Patti.
Thanks for having us.
Give and give and give of yourselves.
Thanks for having us. No, it's a privilege.
Yeah, it is.
It is an honor for all of us to be working on our legacy work together.
We're very fortunate. We're very fortunate to be able to have this collaboration. That's what
to share it, because we're one of these days we will be blinks of eyes of other people, and if we can continue to
Yeah.
open hearts and minds
Yeah.
for our kids.
Well, if we can pass the baton, people can use all of it, pieces of it, parts of it. They can take what they need and leave the rest.
That's right.
Yeah. Well, thank you again. I'm looking forward to our next conversation. Maybe we'll figure out what to do about those 17 years in the next talk that we have.
Or maybe the next time. Who knows?
Right? Thank you, ladies.
Bye-bye.
Thank you for joining me for this episode of Living with FASD Candid Conversations with Patti Kasper. Feel free to send comments, questions, and topics you'd like to learn more about, hear more about, to me at livingwithfasdpodcast@gmail.com. Please remember to like, follow, and share this podcast on whatever platform you use so that more people can find the podcast. Have a blessed week, everyone, and tune in next Monday for another candid conversation on Living with FASD.